We're delighted that BOPA is back in Glasgow again this year. This is, I think, the fourth time that we've been, and it's a fantastic city. So we were officially welcomed by the Lord Provost's office, and that was amazing to show that the city's behind and is supporting our conference as well. We opened the BOPA conference with my colleagues talking about their careers. Now that's quite important because BOPA as an organisation is inclusive, and we have pharmacists from all levels and all experiences. As a profession, oncology pharmacists are quite small in terms of numbers. There's not many of us in individual hospitals, so by coming together as an organisation and sharing how people's career paths have developed, the challenges that they have faced, giving tips and advice to our more junior colleagues, we feel that that's been quite welcomed, and it's quite nice to see as well. I think it's very important to remember that the whole reason that you work in cancer care is about the patient. So starting our conference with key speakers from cancer charities and people who are on the front line working with patients and understand things from the patient's perspective was very important. The headline message from that slide is cancer affects 1 in 2 of us in our lifetime, so it's going to touch everyone. We had some brilliant examples of how community pharmacists have been involved in helping cancer patients, both from raising awareness from a scheme in Lanarkshire where when patients collected their medicines, they were in a pink bag with a message to think about breast cancer screening, so just making sure that people went for screening and getting involved in that way. The biosimilars, it leads on from last year when we were discussing the coming impact of biosimilars. Biosimilars are here and they've been implemented, and the UK has led the way in Europe in terms of rapid uptake of biosimilar rituximab, and oncology pharmacists have been at the heart of making that happen. Our session described how BOPA as an organisation was a leader in that process, setting out guidance and supporting our members doing it. We had 2 case studies, one from the UCH hospital in London, and they showed how they did a straight switch and they switched everyone over to biosimilars. The way they did that was to send a letter to all patients advising them of the switch, to work as a team, pharmacists, nurses, doctors, update their computer system over a weekend to change the drug doses over, and then patients the next time they came in started on the biosimilar. They followed it up by monitoring for infusion reactions, and I've got data to show already that there's absolutely no difference, and they're showing significant savings already. We also heard from a colleague at Nicola Stoner at Oxford, again talking through the process, and she had followed the model developed by the Cancer Vanguard, which gave lots of resources to help with biosimilar implementation. Yeah, we had I guess it was described by one of the other speakers as a tour de force from Prof. Peter Johnson. So he sort of outlined the impact of cancer research, loads of amazing slides about research going forward, looking at how we're getting down to developing patients by the genomic variations. And the key message really overall is, regardless of what research you're in, if you are a patient in a centre that is research active, you do better even if you're not involved in research. So the very fact that actually having a focus on research seems to drive improvements in patient care and treatment. We're delighted to have this session on big data, because big data is a term that you hear bandied about, but what does it really mean? And actually to understand that there are enormous data sets that can be data mined. And it's not about the individual, so people handling big data aren't interested in the individual, but it's the power of what you can do. And you think of the possibilities that, we have data on all the patients we treated, and if we can combine that data with perhaps retrospective analysis of blood tests, etc., we can start to understand and unravel cancer a bit more. The session was very good because it also focused on sort of the ethics and the challenges. And I think the message to come out of that is that in our general lives, people aren't really worried about our data and people using it, apart from if we get called for marketing. But in terms of actually data about our health, people are far more protective. But the message was that actually, if people have the chance to understand and are explained what the data is going to be used for, i.e. it's part of improving patient care, it's anonymised, it's not about them, but that is about people that are in the same position as them. So if your data is put in, then that means that we know more about people with the same problems as you and more about how to help it. So that to me was a highlight. It's a message that we've got to use patient level data, but we have to be very respectful and do it in partnership with patients. So we had 4 plenary sessions. So this year we had our paediatric oncology pharmacists having their meeting as well. So there was a lot of focus on childhood leukemia and various different topics there. We had a colleague, David Thompson, talking about the way NHS England is working on cancer commissioning and their approach to chemotherapy, how pricing and funding is working at the moment. We also had clinical update sessions, including haematological malignancies, CLL, and it's interesting to see sort of the rapidly changing landscape in CLL with lots of new treatments available, when best to use them, which patients to use them for, you know, moving away from just FRC into sort of adding in a ibrutinib, a binatuzumab, ofatumumab, and how they're all going to fit. And then there was also a fantastic session on CAR T therapy, which I think is the science of the future. And I think the science is still, I still need a little bit of work on getting my head around the science because it's quite complicated. I think the message for that is that we're all going to have to learn a little bit more about immunology, because that's going to be an underpin of that. But really, affordability, it comes down to amazing technology, living drugs, but how do we get the good evidence? And then if it's going to be priced in the States at sort of just under $500,000, what's that going to mean for access? We closed the first day of BOPA with a poster session whereby in our hall we had 75 posters of people's practice research. It's our highest number yet, so we're delighted with that. So there was a reception, and delegates were able to mingle, talk to the authors of the poster in the traditional way, and that went down very well. And we're also voting for the best poster, for which we'll present the prize at the end of the conference.